technologies have been able to earn in the recent years. First, starting with Zerona. The Zerona platform, this includes the body as well. Zerona has been FDA cleared for the non-invasive body contouring of the waist, hips, and thighs. In 2012, this technology was FDA cleared. An arm device, much more compact and discreet in its footprint and very unique in its design to provide a full circumferential reduction of the upper arms. It received FDA clearance in 2012 for the reduction of the upper arm circumference. Now, the Zeltiq technology has earned its own highly respected clearances, including reduction of discrete fat bulges along the abdomen and reduction of discrete fat bulges along the flank. Although the technologies seem rather independent, Zerona AD for the treatment of the upper arms, CoolSculpting very effective at the abdomen fat bulges and flank fat bulges, the two technologies are actually very synergistic. While the CoolSculpting targets and focuses on those discrete fat bulges along the waist and flanks, the upper extremities remain free. And the upper extremities can be treated specifically and targeted with the Zerona AD device. Therefore, the two technologies can run simultaneously, utilizing two completely different mechanisms, can provide a greater reduction across the individual, as we'll see or observe reductions in the discrete fat bulges, but at the same time, by integrating this technology, we can concurrently reduce the upper arm circumference, giving an overall greater circumferential reduction. So there is tremendous synergy with the two technologies as they can be operated concurrently, maximizing that treatment room. And that's really a good segue into the next slide. Why combine the technologies? Well, obviously, the first answer is, well, you can treat more than one area, and that holds true. CoolSculpting is going to effectively target the abdomen and flanks, where those discrete fat bulges may reside. The Zerona AD, in its design, can target the upper extremities. So while we're treating the individual for the fat bulges, we can now also treat the individual for the upper extremities. Increase the circumferential reduction. This is apparent. If we're going to get an X reduction off the discrete fat bulges, if we now add the reduction observed or documented for the upper extremities, we can see that we're able to yield an overall reduction. We can report this to the patient. At the end of X amount of weeks with Zerona AD and then X amount of weeks following the CoolSculpting technology, you can say collectively combined you lost X amount of inches or X amount of centimeters because we were able to strategically target the waist as well as strategically target the upper extremities. This in turn will provide an increase in revenue. Why does it increase in revenue? You must consume that treatment room time with CoolSculpting. You require 60 minutes of unilateral treatment to treat the, let's say, left flank, and then an additional 60 minutes to treat the collateral region, the right flank. Therefore, estimated 120 minutes of time must be consumed. Now, whether that's dispersed across 1 or 2 days, different times in the day, or it is performed all at once, 120 minutes, we can now introduce a different service, a different reduction. That time in the room is still being consumed, same amount of time, same amount of labor, no additional technician utilization, no additional technician requirements, no consumptions, no replenishable material, consumable material. Hence, we're simply adding in an additional service, and that will in turn require additional payment, and therefore we have the additional revenue generated. And then bundling can create higher patient satisfaction. A patient will be satisfied with the CoolSculpting results across their discrete fat bulges, but when you can say, now look at your upper extremities, and they can see a difference, and they can see that that bundling created greater change across different areas of their body, we can see how inexorably that will result or manifest in a patient with greater satisfaction. We're giving them more services, hence patients are generally happier when they have more services provided. Now, the cool sculpting technique has been around since 2010, since earning its first FDA clearance. And the technology is quite unique. It utilizes an applicator here as illustrated in the image. This applicator is utilizing a vacuum mechanism to pool the subcutaneous fatty material between two cooling plates, that's crudely described, but two cooling plates that send in energy that meet at a focal point. At this confluence, we see a thermal transition that lowers the temperature down to 42 degrees Fahrenheit. At that cooler temperature, the adipose tissue responds quite uniquely. It is a deleterious change. It damages the tissue. That in turn will result in an infiltration of immune cells that help to further degrade or induce lysis or cell death, and then ultimately through a process known as phagocytosis, basically means to engulf. That then begins the debridement of that specific tissue bed. We see, according to studies, cryolipolysis required in publication 60 minutes to treat one specific area unilaterally. So that means one area, let's say right flank, as we described earlier. And so bilateral treatment, you're going to have to take that applicator if you want a symmetrical treatment, symmetrical reduction. Take that applicator and simply switch it to the collateral side. Not much consumer time, as we understand. So once we position the applicator, that technician can remain in the room to provide patient comfort, but has that liberty to also exit the room. Now we can see Zerona AD. We know and understand the footprint of the Zeltiq technology. But how does it compare with the footprint to Zerona AD? And can we actually fit both technologies in the same room? Well, the image here depicts when Zerona AD is combined with Zerona Body. We can see Zerona Body's footprint consuming the left side of the patient. Its treatment apparatus is coming over the patient, treating waist, hips, and thighs concurrently. If we were to replace that with the Zeltiq technology, it would be a similar footprint, if not a little bit smaller, as that apparatus, that probe or suction mechanism that will be attached to a hose, and that will come over and attach to the individual patient. Therefore, the treatment apparatus is set off in the corner of the room perhaps, and the only thing coming across the patient and traversing the room would be the nozzle that's providing the suction mechanism and feeding it the cooling component. So actually a smaller footprint compared with the Zerona Body, but that's it's not a relative conversation simply because we can observe the small footprint of the Zerona AD. So regardless of the technology there, whether it is the Zerona Body or the cool sculpting technology, regardless of the footprint, we can see that Zerona AD's unique design can fit appropriately up to and close to that upper extremity. Its U-shaped treatment apparatus here gives a nice 360 circumferential treatment of that upper extremity, and we can see that treatment technologies can be utilized concurrently. There is no influence or factor of having two large footprints, as Zerona AD is designed to be a compact treatment for upper extremities. So let's just go through Zerona AD at a glance and from a cursory perspective to give us some understanding of its unique features before we dive into more of the elaborate and detailed science. So Zerona AD, is the only FDA cleared device for safe and effective circumference reduction of the upper arms. That is a wonderful milestone to have been achieved, and that of course is backed by the scientific and clinical data that was required to be submitted to the FDA for their review so that they can make the determination of whether or not this technology should be FDA cleared. More importantly, this data helped explain the mechanism of action and how this technology was able to disrupt the fat cell in order to generate or produce a slimming outcome. Now, the mechanism itself is referred to as a photochemical mechanism. Now, we'll define that term a little bit later, But essentially now for our understanding, photochemistry or photochemical mechanism is simply using light to achieve a clinical outcome without generating heat or vibration. So that means photochemical mechanism is a non-thermal, non-acoustic mechanism. What this ultimately results in is a clinical outcome that is absent of any pain, bruising, swelling, absent of neuralgia, any downtime or side effects for that matter. In fact, if you were to review Zerona AD's FDA clearance letter, you would not see any side effects of this nature. You would see some cautionary components such as do not treat directly in the eye. So in order to overcome that discrepancy, simply provide patients with safety goggles to absorb or ensure that none of the wavelength is permeating the eye. So an innocuous, benign treatment. This is all supported. The photochemical mechanism, the ability for this wavelength, 635 nanometers, to disrupt the adipocyte, all derives from peer-reviewed publications. Now, it is important to note that peer-reviewed publications, these are not white papers. These are not articles that are found in magazines. These are actually peer-reviewed medical journals, aesthetic, plastic surgery, plastic and reconstructive surgery journal, lasers and surgery and medicine journal. So it is important to understand the difference between a white paper, which basically a group of doctors just write. It doesn't go through a vetting process. It's not extensively reviewed by independent peers. It's just submitted to a magazine or disseminated to clinicians. On the contrary, we see that the peer-reviewed process, physicians independently evaluate and assess the quality of the study and the quality and meaningfulness of the data. This is the only non-invasive body contouring device that provides 360-degree treatment of the upper arms in 40 minutes. So why is that important? Well, when we look at the anatomy of the upper arm, we have the shoulder, bicep, tricep juncture. Those three specific points or three specific muscle groups come to a single point, and that's generally what provides the arm its sexy contour. So what that ultimately means, a sexy contour, is that it gives you a nice shoulder definition. So you get that definition that it resides around the shoulder, bicep, tricep juncture. That definition is what ultimately is perceived as a defined muscular arm. Now, also around that area, if we now swing posterior, we see that the fatty accumulation, if the arm's held upright in a 90-degree manner, the material hangs below in the posterior portion of the arm, and that's also something that raises or generates some cosmetic concern for individuals. And so we want a technology that can treat the shoulder, bicep, tricep juncture, the anterior aspect of the upper arms, as well as the posterior aspect. And we want to be able to do that all in a single treatment. And that's really what makes this device unique, is its design for the 360-degree upper arm treatment. And of course, the Zerona platform has been established since 2010, the first FDA clearance. So in that time frame, we've seen over 100,000 patients treated, over 1 million treatments to date. And so this really demonstrates or bolsters the safety profile of the technology, as well as the overall efficacy with this number of patients receiving treatment to date. And again, safe. There have been no reported treatment-related adverse events, and that stems in our clinical trials. So no neuralgia, no temporary nerve damage, no hypo or hypersensitivity. So all of those things are not evident. These side effects are not evident following treatment with the Zerona AD. So that's an important outcome that allows us to utilize this technology in conjunction with other treatments like a CoolSculpting and not have any concerns of further side effects or adverse events. Now, when we look at very briefly, we see a wide assortment of journals that have accepted data regarding Zerona as viable, credible information, and then chose to publish that in well-respected journals, ranging from Plastic and Reconstructive Surgery Journal, Aesthetic Surgery Journal, Lasers in Surgery and Medicine, Clinics in Plastic Surgery, all have published articles, whether it was the histological in vitro data or independent physician led studies assessing the clinical utility of Zerona AD. Now, the ultimate independent body, I should say, that evaluates the safety and efficacy of a treatment is, of course, the Food and Drug Administration. They do an exhaustive analysis. They demand certain parameters and quality of clinical trial in order to demonstrate or elucidate the overall effectiveness of a device before they can even consider providing it a market clearance. So Zerona AD has been FDA cleared for the circumferential reduction or reduction of the circumference of the upper arms. It is important to understand that this first and only FDA clearance includes terminology that speaks to the safety, effectiveness, as well as the sustainability of the clinical result. A lot of questions emerge regarding the longevity or sustainability of non-invasive treatments. Well, how long does it last? Well, if the FDA feels that a technology's results will dissipate over time, if there is no sustainability, the FDA will issue a market clearance or an FDA clearance with a temporary label or tag. This protects them if the result dissipates. It's also an affirmation to the effect that no substantial evidence was provided to them that would demonstrate the results will be sustained regardless of what the patient does. And so most technologies today do have some type of temporary label, temporary thigh reduction, temporary cellulite improvement. This is evidence that the result could dissipate regardless of what the patient does. So when the FDA decided not to put a temporary label, what they were ultimately validating was the longevity of the result. That the mechanism that is used and the clinical outcome that is observed, that could be sustained if the patient now does the right things. If they maintain a healthy lifestyle, healthy diet, participate perhaps in a fitness regimen, then the fat cells that were treated with the Zerona AD technology, they may not fill back up. And therefore, the results observed in 2 weeks may be sustained for long term. Now, we don't want to play the hypothetical game. We do have 8-month follow-up data that shows that after the 2-week treatment phase, the results observed at week 2 are sustained out to 8 months. So that's also why the FDA did not issue a temporary claim, because we provided them with the necessary or essential data to show longevity in the clinical response. Now, overall, as defined by the FDA, Zerona AD is a low-level laser system for the disruption of adipocytes within the fat layer for the release of stored fatty material from these cells, of course, for non-invasive aesthetic use. Now, let's look at the basic effect that Zerona AD has on the fat cell. But before we do that, let's just talk about what we're actually treating. We're treating the fat cell. But specifically, we're treating the enlarged or hypertrophic fat cell. See, what happens after puberty is we rarely accumulate new fat cells. That's known as hyperplasia. It occurs, but it is rare. What generally happens, and why somebody has enlarged arm circumference, is because the fat cells there have expanded nearly 1,000-fold in volume, 20-fold in diameter. And therefore, that accumulation of lipid material and subsequent expansion, that results in tissue girth. And that will, of course, give that oversized arm appearance. What Zerona has been proven to do is it targets those enlarged fat cells. And what it does is it disrupts subtly that outer membrane, that protective outer barrier of the fat cell. When Zerona AD disrupts that membrane, the stored fatty material begins to vacate or release from that cell. That allows the fat cell to return back to a leaner state. Think of it this way. We purchased a brand new water balloon. We walk over to the water faucet. We take this small contracted water balloon, we put it under the faucet, and we turn on the water. What happens? Well, that fat cell begins to expand and expand and expand as it accumulates water. And we could argue that it expands 1,000-fold in volume, 20-fold in diameter. So let's take this water balloon now and make a small little pinhole. We don't pop it, we don't explode the water balloon, but we just lift up the membrane and puncture a little hole in it, and then we set that water balloon down on the table. What happens? Well, that hole we've just created in the membrane of the water balloon, that will allow the water to release or liberate from the confines of that water balloon, from that membrane. And then over time, the balloon will slowly get smaller, smaller, and smaller. And its reduction in volume is a consequence to the removal or displacement of the water. Think of our fat cell as a water balloon. When we're young and fit, have a high metabolism, we can eat whatever we want, but then we go to college and we get the freshman 15, perhaps one or two too many beers, fast food all the time, rushing through classes. Well, what we start to see is that freshman 15 is we get a little bit more girth to us, a little bit huskier. Well, that's the consequence of fat cells accumulating lipid material and expanding and expanding and expanding. So Zerona is the subtle pinprick, if you will. Slowly disrupts that fat cell's membrane and allows what has accumulated to finally begin to leak out of the cell. And that cell that was once collapsed or deflated can finally return back to that state. So through that membrane, or through the disruption of the membrane, we in turn can collapse that hypertrophic or enlarged adipocyte. Now, we hear laser and we immediately equate laser to some thermal endpoint, heating the tissue in some capacity. And that holds true for a majority of lasers that have saturated the market. They utilize what is known or referred to as a photothermal mechanism. Let's break down the root words. Photo is short for photon. That's light energy. So light energy to create a thermal or heating event. And it's that utilization of laser to heat tissue where we get protein denaturation, that's simply the breakdown of proteins. We get an inflammatory and wound healing response, and then we get collagenation, type 1 and type 3 collagenation. And that leads to, or yields, or lends to contracture of tissue. So we get a clinical response because of the tissue regeneration and subsequent collagenation. But Zerona is a different type of laser. Zerona is referred to as a cold or low-level laser. So what mechanism does a low-level laser operate under? Well, it operates under the auspices of photochemistry. So what does photochemistry mean? We said that we were going to define it, so here we're going to define it. Let's break down the root words like we did with photothermal. Photo, again, is short for photon, that's light energy, and chemical is short for the chemical or biochemical reactions within a cell. Therefore, photochemical simply refers to photons modulating or influencing chemical and biochemical reactions within the cell. How is this possible? Well, Zerona AD uses a very specific wavelength, 635 nanometers, to target and stimulate a photoreceptor. What is a photoreceptor? A photoreceptor is basically a receptor that responds to light energy. So think of any other receptor that you learned in medical school or your health training. A receptor responds to some stimuli, generally a molecule. And upon binding, it stimulates that receptor. So just remove the molecule and enter a photon. So a photon enters the body, that receptor absorbs it, changing its function. By changing that photoreceptor's function, we initiate or activate what is known as a secondary cascade. Basically, this is like a game of telephone. Whisper in one friend's ear, they whisper in another, they whisper in another, and you pass the message along. So what happens is we play telephone within the cell. We stimulate the receptor, that stimulates another enzyme. That enzyme then stimulates another one, and another one, and another one, so on and so forth. So this effect ripples and resonates throughout the entire cell. That in turn will affect the overall cell behavior and function. And that's responsible for yielding the clinical effect following stimulation with Sirona. You are actually quite familiar with this mechanism. Many drugs utilize this mechanism to yield the desired clinical response. This is known as an agonist effect. So when you introduce an agonist effect in the body, it's absorbed into the circulatory system. And it travels through the circulatory system, and it's seeking out a specific receptor. It binds to one, or it bounces off one, says, nope, we're not a perfect match. Hits another one, nope, we're not a perfect match. Finally, that drug binds to its perfect match, a receptor. And upon binding to that receptor, it changes the receptor's function. That then sends a signal known as an intracellular signal inside of the cell. And that stimulates an enzyme, activates it. That enzyme activates another one, so on and so forth, in that cascade effect, until we produce or yield the clinical response. Now, an agonist effect, we don't feel or know that it's working. We don't feel our biochemistry changing. We don't know that, a non-steroidal anti-inflammatory is inhibiting COX-2 and therefore reducing prostaglandin production. We don't know or feel it. But what do we perceive? We perceive resolution in our pain. And we perceive for an agonist or drug resolution of whatever medical ailment we're treating. So photochemistry is very similar. We are, in turn, stimulating a photoreceptor, which then activates a secondary cascade. We don't feel or know that this is occurring, but what do we perceive? The clinical benefit. And that is, of course, with Sirona AD, the circumferential reduction of the upper arms in 2 weeks. And we'll get into the data. So what is that photoreceptor? If you are curious, and here I cited the publication, cytochrome C oxidase as primary photoacceptor. Photoacceptor is a synonym for photoreceptor. Photoacceptor for culture cells in visible and near infrared regions. So basically what we have seen is that cytochrome C oxidase, which is a pivotal enzyme in the production of ATP, actually serves as well as a photoreceptor. So we can stimulate and target that, and then that alters adenosine triphosphate production and reactive oxygen species production. So what does that mean for our fat cell? So basically what that means is when we introduce Sirona AD energy, we stimulate that photoreceptor, which is in the mitochondria. We upregulate its function, in turn upregulating reactive oxygen species. Reactive oxygen species likes to begin to break down that protective outer barrier. It's a process known as lipid peroxidation. We won't go into the details of it, but basically, and due to time constraints, we can't. So basically, ROS begins to break down that bilipid membrane, that protective outer barrier, creating what are known as invaginations or transitory pores. And it's these transitory pores that we have been able to document in numerous peer-reviewed publications as a consequence of stimulation with Sirona AD, affecting the fat cell's protective outer barrier, creating these pores, and that's ultimately serving as the means in which fat releases from the cell. And this is exactly what the University of Chicago proved, that when these transitory pores are created through the photochemical cascade, the fat begins to leak out. But first, before we get into detail here, let's just set up these images one by one. Well, let's look at the upper left image. These are pre-treated fat cells. These are fat cells that have accumulated too much fat, and therefore have expanded nearly 1,000-fold in volume. The bottom right, these are control cells. So these control samples basically were exposed to the environmental elements for 120 minutes. What we're looking at here is that there is no alteration or modulation, I should say, in the structural integrity of the fat cell. They still remain enlarged, and they still house that lipid material. But the middle sequence of images, these are cells that have been exposed to Zerona AD for 6 minutes to be exact. And so what we begin to see is this deformity, or this alteration in the integrity of the fat cell. And it is this loss of structural integrity that is a consequence of that bilipid membrane pore. And that pore is now going to serve as an exit or egress for the lipid material. So essentially, it is allowing the stored material to vacate the cell. And so when we look at these cells 60 minutes later, after that 6-minute treatment, we go back in and see what the overall changes are. We see that these once voluminous enlarged cells have now completely collapsed in on themselves. And this is a consequence of the photochemical mechanism altering the fat cell structural integrity and allowing for that fat to release. Now go back to our water balloon analogy. It's starting to make clear sense, or starting to make some sense, that when we fill up the water balloon with an inordinate amount of water, that water balloon expands with a subtle pinprick, that water balloon deflates and collapses under itself. That's what we see with the fat cell. That enlarged fat cell is exposed to 635 nanometers, create the pore, all the fat vacate. Now, it's one thing to have fat cells in a petri dish, in a cultured media, and observe a specific biochemical outcome. It's another to duplicate that response within the human element. Does this parameter of laser permeate the skin? If it does permeate the skin, is it enough energy, or has it been attenuated to such a degree that the response is not observed, that the fat cells remain intact? In order for us to answer these questions, we have to perform a series of studies, both in vivo and ex vivo. So let's start with the ex vivo study. We took, abdominoplasty sections. Abdominoplasty sections were harvested or procured from living individuals and divided into two groups, treatment group and a control group. So a treatment group received actual treatment with Zerona AD, whereas the control group received no stimulation or no activation with any other outside or external energy. Performing punch biopsies, we utilize staining techniques to assess the overall integrity of the fat cell. Now, it is important to note, as illustrated here in the image on the right, the abdominoplasty sections had an intact skin barrier. So this allows us to test this idea of whether or not the skin is impervious, whether or not it's impregnable to this parameter of laser. If we see any change in the overall integrity of the subcutaneous fat layer as compared with the control sample, we could argue that in fact the skin is not impervious. We can permeate this layer and reach with this parameter of laser, we can reach that subdermal tissue layer. And that's exactly what this study proved. Is that we looked at the control sample, we see a collection of hypertrophic, enlarged adipocytes. And this was confirmed through lipid staining techniques. Now, when we compare with the treatment sample, the sample exposed to 635 nanometers Zerona AD laser, we see that the once defined borders and parameters of the fat cell are no longer distinguished. The cells have collapsed in on themselves. And the ability to modulate the fat cells, meaning the laser was able to permeate the tissue, we were able to produce indistinguishable fat layer. So what that essentially means is that cells have collapsed in on themselves. This is again a consequence of that photochemical response. So this study confirmed that 635 nanometers is able to permeate the skin and affect the structural integrity of subcutaneous fat. This was later supported by an in vivo study published in Plastic and Reconstructive Surgery Journal, Volume 110, pages 912 to 922, This utilized scanning electron microscopy. Basically, scanning electron microscopy gives us a 3D or three-dimensional observation of the cell. So here we see on the far left fat cells that have accumulated lipid material and that have expanded. Scanning electron microscopy allows us to see these cells in their 3D nature. Looks like a cluster of grapes or a cluster of water balloons, if you will. However, following stimulation with Zerona AD, 4 minutes to be exact, we see a subtle disruption in the overall structural integrity of the fat cell. The once defined round, voluminous structure or shape is no longer evident, that there has been some degree of deformity here in this sample. Now we begin to see also the lipid material or lipid droplets forming on the outer layer of the fat cell. So this is something that, again, we observed in the University of Chicago study, seeing fat release and that lipid droplet forming on the outer membrane. This is exactly what we're seeing, but now from a 3D perspective. And finally, when we go and look at the cells on the far right, a little bit later, we see that the exposure here, finally the cells have completely deflated or collapsed in on themselves. So they look or appear to actually be two-dimensional. Again, this study, which was peer-reviewed published in Plastic and Reconstructive Surgery Journal, had an intact skin barrier. And yet, even with the intact skin barrier, Zerona AD was able to permeate that dermal layer, reach the hypodermal region, and modulate or alter the structural integrity of the subcutaneous fat. This is a great little image that shows this beautiful demarcation between a sample that received adequate and at the same time inadequate Zerona AD treatment. This also allows us to see the volume discrepancy. The bottom right, we see a sample that received adequate treatment. The upper portion, the bottom portion received inadequate treatment. The upper portion received adequate treatment. And therefore, the upper portion, all the fat has been liberated. The cells have collapsed in on themselves. And what remains on the bottom portion are cells that remain enlarged, voluminous, because they have not released all of their fatty material and therefore still remain voluminous or enlarged. This image is important because it shows the specificity of Zerona AD. In addition to looking at the collapse of fat cells using SEM or scanning electron microscopy, the authors of this paper in Plastic and Reconstructive Surgery Journal also went to look at adjacent tissue. Adipose tissue is a rich, vibrant collection of other cells besides fat cells, neurons, fibroblasts, phagocytotic cells, such as neutrophil, macrophage. So a wealth of different eclectic tissues, cells, I should say. So we don't want a mechanism or response that goes in there and utilizes a mechanism that cannot distinguish between a fat cell and another cell, such as a piece of vasculature, a blood vessel, if you will. Therefore, what this image shows is that only the fat cells are affected. So the blood vessel traversing this sequence, composed of endothelial cells, remains intact and viable. So this shows that this idea of the transitory pore formation and subsequent release of lipid material, that only occurs or transpires within the adipocyte. Now we're looking at a study that assessed the subcutaneous fat layer utilizing magnetic resonance imaging, or MRI, specifically T1 and T2 weighted sequences. The purpose of the study, or the hypothesis, was to validate the depth of penetration, to ensure, again, that this parameter of laser can permeate the tissue layer, specifically the dermal layer, and reach the hypodermal layer to ultimately modulate the integrity of the subcutaneous fat. So let's look at these images first and understand what we're actually looking at. So here we see T2 weighted sequence pre-treatment, and this is the buttocks area. This is a transverse cut, so we're cutting the person in half. This is their buttocks, this is their left iliac crest, this is their right iliac crest, their hip bone, this is their abdominal area, their subcutaneous fat. So we basically cut the individual in half, transverse cut, and we're looking up from their feet towards their head. Now what makes T2 sequences so unique is the manner in which they illustrate the subcutaneous fat layer. Here we see this heterogenic array. And what that means is that there is this chaotic, disorganized pattern of subcutaneous fat. That we see enlarged fat cells here, a little bit here, more enlarged fat cells here. There is no distinct, uniform pattern. That's the definition of heterogeneous, of variety. So we can identify the fat layer and how deep it is, and how thick it is, I guess, is the correct terminology. So after treatment with Zerona output parameter, what we see is that the once ill-defined borders, the utter chaos or disarray within the subcutaneous layer, is no longer evident. That there's been a coalescence of tissue, meaning the fat cells have basically merged to create this uniform pattern. But we know what's ultimately taking place. We're treating the fat cells. The fat cells are releasing their intracellular contents, their intracellular lipids, and the cells are collapsing in. So the once defined parameters or borders due to the enlarged fat cell is no longer evident because the fat cells have collapsed in on themselves. So this creates a homogeneous appearance, meaning a defined border appearance. And that's because the cells, there's this coalescent effect. Now, in partnership with radiologists, it was confirmed that Zerona penetrates close to 4.5 centimeters with an intact skin barrier. So this idea that this parameter of laser is unable to penetrate is not supported by any bit of clinical literature. In fact, there are peer-reviewed publications that show that this parameter of laser can quite readily penetrate and reach the subdermal tissue. So overall, the conclusion is that Zerona AD targets a photoreceptor that initiates a secondary cascade. That secondary cascade creates a opening or transitory pore within the fat cell's membrane that allows for the stored fat to leak out and the cells to ultimately collapse. So where then does the fat go? Well, actually, the process in which fat is displaced from the area is quite synergistic with natural fat metabolism. So when you're dieting and exercising, what are you doing? Basically, what you're doing is you're creating an energy demand. And that energy demand must be satisfied by your natural energy reserves. So your stored fat, your stored sugar. So the more you exercise, the longer you diet, the more thyroid-stimulating hormones are going to be released, more catecholamines, epinephrine, and norepinephrine. And all of these things are doing one thing. They are activating the conversion of triglycerides into free fatty acids within the fat cell. Why is that important? There is no other way to get the fat, specifically the triglyceride, out of the fat cell without first converting it to a free fatty acid. This is known as lipolysis. The very first step of lipolysis. This is a hormone-dependent, complicated process. Zerona circumvents all of this. We don't rely on the release of free fatty acids. Instead, by creating the transitory pore, we know from studies that we're releasing primarily triglycerides. Those triglycerides are now safely broken down in the lymphatic system into a free fatty acid. So the lymphatic system possesses an enzyme, specifically lysosomal acid lipase within lymph nodes, that will convert triglycerides, which are unhealthy, into a healthier version, which is known as a free fatty acid. From this point further, the overall mechanism to metabolize or burn that fat is no different Then natural fat metabolism. Free fatty acids continue along the lymphatic system where they're deposited into the circulatory system via the thoracic duct and subclavian vein. From there, the free fatty acids are transported to a wide assortment of tissue: liver for further fat metabolism, skeletal muscle, and heart tissue. So overall, Zerona AD releases the fatty material in the upper extremities. That is displaced through the lymphatic vessels, broken down within lymph nodes, specifically axial lymph nodes under the armpit, into a free fatty acid. The free fatty acid enters the circulatory system, where it's transported to tissue to drive basal or resting metabolism or activity-induced metabolism. So overall, a benign, innocuous mechanism. And also a mechanism validated by peer-reviewed publications. This particular study followed patients after each Zerona treatment and measured lipid panel data to ensure that there was no transient rise or elevation in blood cholesterol or triglyceride levels. This data was submitted to the FDA, and the fact that the data showed a reduction rather than an increase allowed the FDA to provide an FDA clearance with no concerns or risks of altering the blood chemistry. Because whenever you mention fat and the blood all in the same sentence, that's usually not a good thing. That's usually a bad outcome. You have too much fat in your blood, you need to consume a statin, or you need to change your diet. But in this case, with Zerona AD, it's a positive outcome. We're able to alter the contour of the upper arm extremity, of the upper extremity or upper arm, without altering the integrity of the fat cell, without altering the integrity of the blood chemistry. Now, in addition to the fasting lipid panel data, it was important for us to perform a study that eliminated as many confounding variables as possible. And so in order for us to do that, we had to perform a placebo-controlled, randomized, double-blind, multi-center clinical trial. A trial in which no patient knew what type of treatment they were getting. They didn't know if they were getting the real treatment or the fake treatment. There was no diet, there was no exercise, there was no lymphatic stimulation. It was a dry study. Fake Zerona AD versus real Zerona AD. 6 standard treatments were applied every other day for 2 weeks. Monday, Wednesday, Friday the first week. Monday, Wednesday, Friday the second week. Patients, their results were observed and reported in that second week. In that second week, patients lost, on average, 3.7 centimeters combined off of both extremities in just 2 weeks, without diet, without exercise, compared with a 0.2 centimeter reduction reported for the sham group. Therefore, the results objectively were statistically significant. Now, the question is a 3.7 centimeter reduction meaningful to the patient? Is that visible? So, in addition to the objective assessment, we performed a subjective assessment. We had subjects fill out a satisfaction questionnaire, rating their overall arm reduction as either being very satisfied, satisfied, neutral, dissatisfied, or very dissatisfied. 80% of test group subjects were satisfied or very satisfied with their upper arm. So that means that in 2 weeks they were able to perceive a difference. 0% of subjects were dissatisfied. 90% of subjects believed their upper arm appeared improved, so they could visibly see the circumferential reduction. And 50% of subjects said that the results exceeded any expectations. That is powerful objective and subjective data. And we can meld these two to demonstrate the overall clinical utility of Zerona AD. Now here we have some before and after images. We have many, many before and after images. These are just a quick overview. This is a subject that combined off the left and right extremity lost 6.4 centimeters. We can see the consistency of the before and after images, a nice contouring effect, a slimming effect in these upper arms, a beautiful response. This patient lost 8.9 centimeters across both left and right extremities. We can see great definition, great circumferential reduction. All of these images, by the way, were provided by Dr. Mark Nestor, MD, PhD, who was the principal investigator of the study. And finally, here we see subject C, a 6.4 centimeter reduction across both upper arms. And these are results, again, in 2 weeks. Now, the fundamental question for any contouring technology is how long or how sustainable is the result? Will it last several weeks, several months? So in order for us to properly address this question, it is imperative to perform a high-quality study. So in addition to the 2-week assessment, we followed patients 8 months out, to be exact, 7.6 months. Subjects in the test group demonstrated a reduction of 3.25 centimeters. So there was a minor gain, but a gain that was not statistically significant. It was a change of roughly 0.45 centimeters. So the result went from 3.7 centimeters to 3.25 centimeters, an inconsequential change. However, sham group subjects, when they were observed 8 months later, they reported a combined increase in the circumference of 1.1 centimeters. That was a statistically significant change. So even out at 8 months, we possessed a statistically significant difference when comparing treatment and control groups. So what this allowed the FDA to do is it allowed the FDA to issue a clearance absent of a temporary tag or label. And so Zerona AD is the first and only FDA cleared device not for the temporary reduction, but for the reduction of the upper arms. So that concludes our educational seminar. So in summation, we have a fantastic technique, CoolSculpting Zeltiq, that has been FDA cleared to specifically target the fat bulges along the flanks and abdominal region. There is a procedure room consumption time, meaning X amount of minutes must be allocated in order to treat those discrete fat bulges. Therefore, the technician must be confined to the room, the patient must be confined to the room, and ultimately the technology, the Zeltiq device, being utilized for whether it's 60 minutes, 120 minutes, 240 minutes. But that individual can undergo other services. Specifically, they can receive treatment with the Zerona AD device for the full 360 degrees circumferential reduction, targeting the shoulder, bicep, tricep juncture, effectively targeting the posterior aspect of the arm, so that we could treat more than one area in the time that is required for the CoolSculpting technique. We could treat the upper extremities, which no other technology could do because they today have no FDA clearance for the treatment of the upper arms. So collectively, this allows us to treat more areas, garner greater patient satisfaction, and at the same time generate greater revenue as we're maximizing the treatments and services provided during the 60 to 120 minute treatment time. Maximizing the treatment room time. So hopefully, and I truly hope that I was able to articulate and elucidate the clinical utility of Zerona AD. Its small footprint and unique design gives us that 360 degree circumferential reduction that has been validated in a placebo-controlled randomized double-blind multi-centered study, losing 3.7 centimeters in 2 weeks, an outcome blended with subjective and objective data, an outcome that allowed the FDA to grant or issue the first ever clearance for upper arm circumferential reduction. So there is tremendous synergy with Zeltiq and the Zerota AD technology to give your patients the best form of care possible. So with that being said, you see my email address here, rmaloney@primcogent.com. If you would like to discuss in greater detail the clinical aspects, feel free to contact me at any time. I would love to continue this conversation and, more importantly, provide you with the peer-reviewed publications so that you can delineate the clinical utility on your own. If you would like to discuss more of the business side of things, you can speak to our head of North American sales, Kelly Guest, a wonderful individual, versed in the technology, versed in the aesthetic space, and can articulate the clinical utility as well as the revenue potential for Zerota AD when combined with the exceptional technology that is CoolSculpting. So you can reach Kelly Guest at kguest@primcoach.com. So with that being said, I truly appreciate taking the time out of your day to attend the Zerota AD educational seminar. And I truly appreciate your attention, and I look forward to working with you and hearing from you in the near future. Thank you very much.